Hi, I'm Shivakumar, Assistant Professor, Department of Pharmaceutics, Sri Shanmuga College of Pharmacy, Sangagiri, Salem. Uh, Today we discussed about powders. Powders. First, introduction. Pharmaceutical powders are solid dosage forms where one or more drugs are dispensed in finely divided state. They can include additional ingredients called excipients and appear in either crystalline or amorphous forms. Advantages of powders. Why do we use powders? First, they can be used both internally and externally. They are more stable than liquid medicines. They have a faster onset of action because they dissolve quickly in body fluids compared to tablets or capsules. They are easy to carry and simple to take by dissolving them in liquids. Advantages of powders. Drugs with a bitter or unpleasant taste are not suitable. Some drugs are absorb moisture from the air and require special double wrapping. It is also difficult to weigh very small quantities, specifically amounts less than 100 mg. Next, preparation and size reduction. First, how to prepare divided powders. To prepare these, we follow 5 steps: reducing particle size, sieving, weighing, mixing, and finally packaging. A pro tip for pharmacists: always calculate for one extra powder than required to cover any unavoidable loss during the process. First one, size reduction. Size reduction, also known as grinding or pulverization. It increases the surface area for better drug distribution. On a large scale, we use 4 main methods. One is compression, second impact, third one shear, fourth one attrition. First, compression. Positive pressure using a ball mill. Impact using a hammer mill. Third, shear using a colloid mill. Fourth one, attrition using a fluid energy or roller mill. Sieving, and third, weighing each ingredient. Fourth one, mixing of powders. The powders may be mixed by one of the following mixing methods. First of all, spatulation. Second, trituration. Third, geometric dilution. Fourth one, sifting. Fifth one, dumping. Next, mixing techniques. In the mixing techniques, first, spatulation. Mixing is a crucial for uniform dose. Spatulation. Mixing with a spatula on a paper or tile. It's great for small amounts or substances that liquefy when touched. This method is very useful for mixing. Number one, small quantities of powder. Second one, solid substances that liquefy from aquatic mixtures when is close and prolonged contact with one another, since very little compression or compaction results. This method is not suitable for large quantities of powders or for powders containing one or more potent substances because homogeneous blending may not occur. Trituration. Trituration is used both reduced particle size and mixed powders. Using a mortar and pestle, porcelain mortars are best for reducing particle size because of their rough surface, while glass mortars are better for chemicals that stain for simple mixing. A glass mortar also cleans more readily after use. Geometric dilution. The geometric dilution is for potent drugs, that is drugs that work in very small doses. You mix the drug with an equal amount of diluent like lactose and keep doubling on the volume at each step until everything is incorporated. Example of geometric dilution. If 100 mg of potent drug is required to be mixed with 900 mg of lactose, the following procedure is followed. 100 mg of drug is mixed with 100 mg of lactose, then the 200 mg of mixture is mixed with another 200 mg of lactose, and so on. One is shifting. Shifting involves passing powder through a shifter for a light, fluffy result, but it is not for potent drug. Next one, dumpling. In the industry, we used dumpling, which uses large motorized containers to mix massive volumes of powders. Next, packaging. Powders may be wrapped in a paper or dispensed in bulk in wide mouth container. Wrapping of powders. White glassed paper is generally used. Wrapping should be done on a clean tile or a large sheet of glassed paper to protect the product. We classify them into 5 groups: bulk powders, bulk powder for internal use, bulk powder for external use, simple and compound powders for internal use, powders enclosed in a caches and capsules, compressed powders, that means tablets. Bulk powders. Bulk powders are used when the exact dose isn't critical, like antacids or laxatives. They are when accuracy of dosage is not important. The several doses of powder it contains bulk powders. They are supplied in wide-mouthed containers that permit easy removal of a spoonful of powder. Non-potent substances commonly supplied in a bulk include antacids and laxatives. Bulk powders for external use. For external bulk powders, the label must clearly state they are for external use only. The powders are supplied in cardboard, glass, or plastic containers designed for specific method of application. Dusting powders are preferably supplied in perforated or shifter top containers. The container should bear a label clearly indicating that the powder is meant for external application. Bulk powders commonly used for external applications are: first one, dusting powders; second one, effervescent powders; third one, insufflations; fourth one, snuffs; fifth one, dentifrices. Next, dusting powders. There are very fine powders applied to the skin. Medical types are for skin conditions, while surgical types are wounds or body cavities. The dusting powder should be passed through sieve number 80 to enhance their effectiveness. There are two types of dusting powders are there. One is medical dusting powders, another one is surgical dusting powders. The characteristics of dusting powders are no local irritation, flow easily, spread uniformly, good covering capacity, and good absorptive capacity. The medical dusting powders are used for superficial skin conditions, whereas surgical dusting powders used only in body cavities and also major wounds resulting from burns on umbilical cords of infants. Medical and surgical dusting powders must be sterilized before use by the dry heat method at 160 degrees Celsius for 2 hours. In the preparation of dusting powders, we are used talc, kaolin, and starch, and they are chemically inert. These ingredients are readily contaminated with pathogenic bacteria. Therefore, they must be sterilized before use by the dry heat sterilization method. The dusting powders are dispensed in shifter or aerosol containers. They are non-toxic, but inhalation of fine powder ingredients by infants may lead to pulmonary inflammation. Proper care should be taken while handling. The uses of dusting powders are antiseptic, astringent, absorbent, and antiperspirant. Insufflations blown into body cavities like the nose or throat using a insufflator. Nowadays, insufflations are available in the form of pressure aerosols, and these aerosols are used for potent drugs. Insufflations are used to produce local effect in the treatment of infections of the air, nose, and throat using antibiotics to produce systemic effect from drugs that are destroyed in the gastrointestinal tract. Next, snuffs. Snuffs nothing but inhaled into nostrils. They are finely divided solid dosage forms. They are inhaled into the nostrils for the uses of antiseptic, bronchodilator, and decongestant actions. The snuffs are dispensed in flat metal boxes or glass containers with hinged lids. Next, dentrifiers. Dentrifier is nothing but tooth powders containing like calcium carbonate. The tooth surface with the help of the brush they are applied. They contain suitable detergents or soap, abrasive substance and suitable flavoring agents. These agents such as calcium sulfate or calcium carbonate, sodium carbonate and sodium chloride are used in the fine powder form. Effervescent powders. The effervescent powders contain acid and base mixtures that release carbon dioxide when added to water, making them easier to taste. The forms of medication for internal use consisting of a powdered or granulated mixtures of citric acid, tartaric acid, or sodium biphosphate with sodium bicarbonate. In the presence of water, the acid and base react to liberate carbon dioxide and produce effervescence. The storage of effervescent powders are kept in tightly closed container. The advantages of effervescent powders: mask bitter and nauseous taste, promote gastric secretions, act as a carminative, and requires minimum moisture. In the effervescent powder, the sugar used as a sweetening agent. The medicaments provide therapeutic action. They should be anhydrous and water soluble. Preparation method. The effervescent are prepared by two types. One is wet method and another one is dry method. These are the examples of effervescent powders: citric acid, tartaric acid, malic acid, fumaric acid, adipic acid, sodium bicarbonate, sodium carbonate, potassium bicarbonate, potassium carbonate. Next, simple and compound powders for internal use. In this form of powder, each individual dose is enclosed in paper. When the number of ingredients is 1, it is called simple powder, and more than one is called compound powder. The minimum quantity of each powder should not be less than 100 mg so that it can be handled conveniently by the patient and weighed accurately. Next, simple powder. The only one ingredient contains is called simple powder, either in crystalline or amorphous form. If the powder is present in crystalline form, it is reduced to a fine powder, weighed, divided into the required number of doses, and wrapped as individual doses. The two or more substances are mixed together is called as compound powders. The mixture is then divided into desired number of individual doses which are dispensed into separate powder papers. Next one, powder enclosed in catchets. Catchets are solid dosage forms of drugs and are also called wafer capsules. They are molded from rice paper, made by pouring mixture of rice flour and water between two hot polished revolving cylinders. The water evaporates and forming a sheet of wafer. Catchets are quite hard to swallow as such, but they are softened by dipping in a water for a few seconds, then placed on the tongue and swallowed within draught of water. After swallowing, the catchet disintegrates and releases the drug. Next one, compressed tablets. The compressed tablets are powders molded into two tablets. They are flat, circular discs and usually contain potent drug which is mixed with lactose, dextrose or other suitable dilutes. The apparatus is made of stainless steel or plastic. It consists of upper and lower perforated plates having exactly the same number of holes as the number of pegs in the lower plate. The lower plate also has two large pegs which ensure correct fitting of the plates. The molds are available in several sizes with a capacity ranging from 30 mg to 250 mg. The powder and diluents are mixed together and made into stiff paste with the help of alcohol with 60%. The paste is then introduced to the upper plate with the help of spatula, filling all the holes and removing the excess material. The paste is placed over the lower plate. Gentle pressure is applied over the top plate, forcing it to move downward and leaving the molded tablets on projected pegs. The prepared tablets are then dried in hotter oven or by keeping them in warm place. Last, thank you.